Ok, vamos a leer la segunda parte de este libro, ya que Zoom solamente permite grabar 40 minutos y esta es la segunda parte. 9.1. Complete a table with words from A, B, and C opposite. Put a stress mark in front of the stress syllable in each word. The first one has been done for you. Okay. Admit is it's admission, assessment, discharge, operation, referral, treatment. Entonces, make words combination using a word from each box, excuse me. Look at C opposite to help you. Acutely va con Hill, assessment unit, on duty, referral letter, and waiting list. Which hospital department would be most appropriate for the following patient? Look at A, B, and C opposite to help you. A woman, a woman in diabetic coma is intensive care unit or ICU. A patient who had just had a radical pros, pros, prostatectomy is high dependency unit. A patient who has a skin lesion removed is day surgery unit. A man with a foreign body in his height is gynecology emergency. A woman with a threatened abortion is accident and emergency. Complete the extra from information with leaflet from patient. Okay, information for our patient. When you arrive at the clinic or hospital, please tell receptionist who will come you. Check your data and direct to the rating area. The length of your visit will depend on the treatment you are going to have. You may need to have some tests such as X-ray, which could mean going to another department, or maybe refer to the other professionals, such as physiotherapists or dietitian. You may need to visit the clinic. If staff at the clinic want to see you again, another appointment will be arranged for you. If you need to be admitted at the hospital for more treatment, either in a patient for day surgery, you will be told when he's likely to happen. If you don't need further treatment, you will be discharged to your GPS or GPS is GP, General Practitioner's Care. Okay, primary care. The National Health Service, NHS, is responsible for healthcare for everyone in the UK. Although a small number choose to pay for private care, treatment is free, but there are prescription charge for drugs and appliance, such as cervical color, with exception for some patients, such as children and the elderly. Primary care is provided by general practitioner or GP, sometimes nor family doctor, nurses, dentists, pharmacists, and opticians. General practitioner work in practice of 1 to 20. Practice are based in a surgery and look after health from 1,000 and 15,000 people in their local community. They also provide health education in areas such as smoking and diet, run clinics, give vaccination, for example, for influenza, and may perform minor surgeries such as removal for rats and molds. If a patient needs specialist care, the GP or general practitioner will make a referral or refer the patient to a consultant in secondary care. Patients are normally seen on an appointment-based home visit made when patients are housemen unable to leave their homes or to attend surgery of out of hour OOH treatment from 6 p.m. to 8 is provided by the local primary care trust, which organize a shift to GP general practitioners and locum general practitioner to record with someone in absent. Entonces, the practice team, a typical general practitioner employee receptionist, they're responsible for initial patient contact, making appointment, taking requests to repeat prescriptions, taking message from patient and other healthcare provider, and for filling and scanning document into patient record. The practice manager has responsibility for finance and sometimes for IT, supervises reception staff, our locums, and help prepare to practice development plan. Practice nurse run asthma, diabetes, or cardiovascular disease clinic. as well as a one-to-one clinic for those who who wish to give up smoking. In addition to practice staff, GP work with a number of health professionals. First one is district nurse. We visit temporary hospital patients, such as recently discharged hospital patient, to change dressing, such as ulcer dressing. Second one is health visitor. Visitor family to carry out checkups on young children, particularly under five, to make sure they are healthy. A special attention is paid to family in need, such as those living in poverty. There are also to baby immunization. My wife run clinic for internal patient. Physiotherapy provide hands-on treatment, but also teach patient exercise that can improve their condition after condition or operation. Thus, at GP's Day, Dr. Stewart works in practice in small market town with three other of the family doctor. The surgery is in the center of the town and she's shared by three practice. This is a typical working morning when she's not the duty doctor responsible for emergency and urgent problems. But let me translate this part first. Eh, okay, talk about primary care, que es como el cuidado de los o sea, como que la atención primaria. Entonces, el Servicio Nacional de Salud, como que habla de que el Servicio Nacional de Salud es responsable de la atención sanitaria de las personas y de cómo las personas en el Reino Unido, aunque un pequeño número opta por pagar la atención privada, el tratamiento es gratuito, pero hay un cargo por prescripción de medicamentos y aparatos, como un collarín cervical, excepciones, algunos pacientes como niños y ancianos. Entonces, la atención primaria está a cargo de médicos generales, a veces conocido como General Practitioner, enfermera, dentist, farmacéutico o opticians como optómetra, como los médicos cabecera que trabajan en consulta con unas 20 personas. Las consultas se basan en una consulta que se ocupan de la salud entre 1.000 y 15.000 personas en su comunidad total. También brindan educación sanitaria en áreas como el tabaquismo, dieta, y administran vacunas, por ejemplo, contra la influenza, y pueden realizar cirugías menores como eliminación de verrugas y lunares. Si su paciente necesita atención especializada, ya ahí lo refieren a otros tipos de médicos. Entonces, los pacientes son normalmente, o sea, los pacientes normalmente son atendidos con cita previa, appointment basis. Entonces, las visitas domiciliarias se realizan cuando los pacientes están prácticamente en una sala de 6 a 8 y le brindan atención primaria y de ahí van organizando para que el paciente pueda, el general practitioner, para que el paciente pueda volver a su estado normal. Entonces, la parte B, que es de practice team, entonces nos habla de que el equipo de práctica, como el team, una práctica típica de un médico de cabecera emplea recepcionistas, son responsables del contacto inicial con el paciente, programar citas, aceptar solicitudes de receta repetida, recibir mensajes de los pacientes y otros proveedores de atención médica y archivar y escanear documentos en los registros del paciente. El director de la práctica es responsable de las finanzas y a veces de IT y supervisa al personal recepcionista, contrata sustitutos y ayuda a preparar el plan de desarrollo de la práctica. Las enfermeras practicantes dirigen clínicas como de asma, diabetes, enfermedades cardiovasculares, así como consultas individuales. Es una clínica que quienes desean de fumar y así sucesivamente. Además, los médicos de cabecera trabajan con varios profesionales de la salud, como son las enfermeras distritales, que son aquellas enfermeras que visitan a los housebound, que es como a los confinados en casa, y le dan seguimiento para ver cómo siguen y todo. Están los visitadores sanitarios, health visitors, que son como visitan las familias para realizar controles o sea, que a los niños pequeños, especialmente a los de 5 años, para asegurarse de que estén sanos. Y los midwives son como aquellos que dirigen clínicas para pacientes prenatales. Y los fisioterapistas son como que proveen un tratamiento práctico para enseñar a los pacientes a hacer ejercicio para que puedan mejorar su condición después de un accidente o una operación. A GP Doctor, que es como el día de un médico general. Entonces tenemos el doctor Stewart, dice que trabaja en una consulta en una pequeña ciudad comercial con otros tres médicos de familia. La consulta está en el centro de la ciudad, es compartida por tres consultorios. Esta es una típica mañana de trabajo en la que no es, en la que ella no es la médica de guardia responsable de la emergencia y problemas de urgencia, y aquí nos pone su horario, cuándo llega, cuándo se va, y así sucesivamente. Entonces, complete the sentence. Ahí se ve borrosa. Okay. Complete the sentence, look at the opposite to help you. Children over 60s and people with some chronic disease do not have to pay prescription charge in the UK. Patient with immobility problems may be unable to go out to their houseman. The average GP appointment 3 minute long. A lot could be someone who take the place of staff member who is on leave. Care outside working hours is now as out of hours treatment. Make word combination using a word for phrase from each box. Discharge back on dressing, make appointment, perform minor surgery, refer back clinic, supervise staff, take message. Which member of practice team will be responsible to each of the following? Running a clinic for pregnant women is midwife, teaching a patient how to strengthen strengthen his broken leg is physiotherapist, letting the GP know the patient can come to her appointment is receptionist, running a clinic for people who want to lose weight is practice nurse, teaching a patient was a returned home after any operation is district nurse, carrying out checkups on children is poor neighborhood, its health visitor, organi- organizing cover for an absent doctor is practice manager. Complete the diary for Dr. Stewart afternoon. Entonces, one is afternoon surgery, 12, 10 minutes to appointment, check with his reception for message, for a visit, and repeat prescription request, seeks referrals, and one and funds switches OOH service. Also, medical education one. Medical education in the UK. Medical education in the UK covers undergraduate education, 4 or 5 years. A medical doctor, the section of the university responsible for medical education. So a 2 years foundation program which provide training to new doctor after graduation. There are a series of placing in different specialty. Postgraduate training which doctor take to become GP or consultant. Senior specialists often delivered though a college different, especially for example the Royal College of Physicians. Continuing professional development is the form of courses and seminars which doctors undertake throughout their working lives to keep out to date. Extract from undergraduate prospectus. The MBCHB is Bachelor of Medicine, Bachelor of Surgery. It's a 5 years undergraduate medical degree course. Most of learning take place in small groups. The main component are core one is year from 1 to 3 in integrated program as clinic and scientifics scientifics, yes, topic mainly presented our problem basic training. Student selected module is a allow you to shows from a many of subjects such as sport medicine or even study a language as preparation for overseas elective. Style vocational study as clinical skills. This component prepare for clinical skills required for contact with patient from years one of your course. Clinical attachment, service of 4 week clinical attachment medicine, surgery, psychological medicine, child health, obstetrics, gynecology, and general practice. Entonces, at student view, Ellen, a medical student, describe her course. I'm just finishing my first year of medicine. What I like about this course is that you're involved with patient from the very beginning. Even in our first year, we spend time in hospital. Much of the course in PBL. We have 2 years section a week there. A week where we work in groups for 8 to 10 serving clinical problem. We decide together how to tackle. Oh, primera vez esa palabra, tackle problem, look up books and online source. sources. Make notes and discuss the case together. It's a great way for learning and getting to know the other student. In past, medical student has lecture with the whole class taking notes from lecture from 9 to 5 p.m. But now it's so many mainly group work, although we do have some lecture to seminar where we work in small group with a tutor. I like how for it of it. Even the dissection we got a couple of cadavers from second month of the course. So now let me mm, entonces la educación médica en el Reino Unido dice que el primero es la educación universitaria, 4 o 5 años en la Facultad de Medicina, la sesión de una universidad responsable de educación eh, médica. En el segundo año proporciona la formación de nuevos médicos, después la graduación a través de una serie de prácticas en diferentes especialidades. 3 es la formación de posgrado, que es como un entrenamiento donde toman para convertirse en especialista a partir de la Universidad de Royal College of Physicians, lo que continúa desarrollándose en forma de cursos, seminarios y lo que se mantienen, o sea, se va a mantener actualizado. Entonces, Extra Form, que es como el extracto de un prospecto de pregrado, es como que nos habla de Bachelor of Medicine, licenciatura en Medicina, en Cirugía, es una carrera de 5 años de pregrado en Medicina, y, y así. It must of learning take place in small groups. Los componentes principales son, main components are Core 1, Basic, que es como el año básico, que es donde un programa de integrado de temas clínicos científicos, donde usted empieza como a tener conocimientos y a aprender la base de la medicina. Los módulos seleccionados para estudiantes, como unos pequeños módulos que están en la materia y así. Los estudios vocacionales y habilidades clínicas, como son componentes para preparar al estudiante para tener las competencias requeridas al tener contacto con los pacientes. Y los pacientes que están adscritos o pacientes que recién llegan a un departamento, la práctica general. Entonces, los anexos clínicos que son como de cuando tienes 4 a 5 años, como una serie de 4 semanas, tú haces una rotación, sea en cirugía, en cuidado infantil, ginecología obstetricia y la práctica general. Entonces, a Student View es como la opinión de los estudiantes. Aquí nos habla de que, dice, yo recientemente estoy terminando mi primer año de medicina. Lo que me gusta de este curso es que te involucra con los pacientes desde el principio. Incluso en nuestro primer año pasamos un tiempo en el hospital. Gran parte del curso de PBL. Contamos con sesiones de 2 horas a semana donde trabajamos en grupos de 8 a 10 resolviendo problemas clínicos. Decidimos juntos cómo abordar el problema, buscamos libros y fuentes en línea, tomamos nota y discutimos casos juntos. Es una excelente manera de aprender y conocer a los demás estudiantes. En el pasado, los estudiantes de medicina tenían clases en las que toda la clase tomaba nota al profesor de 9 a 5, pero ahora trae principalmente de trabajo en grupo, aunque también tenemos algunas conferencias y seminarios, y trabajamos en grupo pequeño con un tutor. Me gusta todo, dice ella, incluso la disección, podemos cortar cadáveres a partir del segundo año. Should match this activity stage of medical education. First one is dissecting cadavers on the grade. Keeping along surgical procedure observed and performed by the physiotherapist, working for our month in accident and emergency to experience this specialty foundation program, taking a 4-week attachment in obstetrics and gynecology is undergraduate, taking an online courses to recent development in cardiovascular disease, continue professional development. To complete the sentence, just before their final year, students have to change to take an elective in a hospital just their choice anywhere in the world. Problem-based learning construct with a approach where each subject is tough separately, yes, el pasado de teach. These days, lectures are often interactive with regular opportunity to student to ask questions. For in clinical attachment, students learn how to treat and manage patient. Students select modules can be a topic from outside medicine, such as a foreign language. Sections of collaboration is an important part of an anatomy component. The medical school at the University in Edinburgh is one of the oldest in the UK. She's a consultant at the Royal, one of the learned in pediatric hair specialists in the country. The Royal College Surgeon Edinburgh date from 1505. They have a seminar each week where they discuss topic a small group with our lecturer. Watch this activity to one component of the undergrad called Scribe B and C. July spent 6 weeks working in a small hospital in Himalaya. It's overseas elective. A group of students discussed together the possible reason for abdominal pain after meals in Upset, 44 years old, man, is problem-based learning, PBL. Small group of students track pulmonary artery in the collaborative section. Others spend a month working in the pediatric ward of the local hospital in clinical attachment. And learns how to take blood from another patient in clinical skills. Juma chose to study travel medicine in 4 years. The students select a module. Okay, 12 is medical education 2, a foundation. Hi, got a foundation program. Foundation program is a 2 years training program which formed to bridge between university level study and medical school and especially the general practice training. It consists of a series placement, each lasting for month, which allow the junior doctor knows to train same to different specialty, for example, pediatric. Everyone's trainee FY1 corresponding position as officer PRHO post years of training FI2 FY2 senior house officer SHO post. Each training has an educational supervisor to ensure that small senior doctor deliver training in different ways, including clinical and education supervision. To progress train have to demonstrate a range of clinical competence which are assessed by observation in their workplace. As a people in medical education, tutor in academic is some case postgraduate student led tutorials demonstrated in anatomy teaching. Someone will demonstrate how to dissect. Australia offered postgraduate student paying their way through medical school. Senior lecturer is academic with teaching and research responsibility will contribute teaching particular discipline. Professors, a senior academic with teaching and research abilities for a particular discipline, usually leading figure in their discipline. College tutor, considered responsible for delivering a college training program. Clinical trainer, considered assigned to train, will provide training during period of direct clinic care. Education supervisor, a consultant who supervise training period of training. And medical qualification, MDS, the Bachelor of Medicine Science, a degree often taken after 2 years of medicine study by a student who may wish to follow a career in medical research. Bachelor of Medicine, Bachelor of Surgery, Bachelor degrees are undergraduate degrees. Doctor of Medicine, Diploma of the Royal of Aesthetic Gynecology, Member of the Royal Physician, Member Fellow of the Royal, como una subespecialidad, Fellow. How doctor become a fellow depend on their college for the FRCS. Further examination must be passed. Further college is by nomination work assessment. Traducir esta parte para no volver para atrás de nuevo. Nos habla de la educación médica, pero la parte 2 nos habla del programa en la fundación. De que el programa básico es un programa de formación de 2 años que forma el puente entre los estudios de nivel universitario en la Facultad de Medicina y en la formación especializada o de la práctica general. Consiste en una serie de prácticas, cada una de ellas en 4 meses de duración. Ya que un médico novato, conocido como aprendiz, puede formar parte de diferentes especialidades y rotar, por ejemplo, por pediatría, un año en prácticas. Cada alumno tiene un supervisor educativo que garantiza que los médicos más experimentados aportan o imparten información de diferente manera, incluida la supervisión clínica y educativa. Para hacer progresar los alumnos deben demostrar una variedad de competencias clínicas que harían ante la salvación que le va a hacer ese supervisor. Entonces, people in medical education, o sea, la gente en la educación médica. Está el tutor, que es como la persona, como académico, que es algo que es, o algún caso puede ser un estudiante de posgrado que dirige tutorías. Está el demostrador, que es como el que enseña anatomía, las disecciones, que muestra cómo diseccionar. Las manifestaciones suelen ser estudiantes de posgrado que pagan sus gastos a través de una escuela. Entonces están como los profesores titulares, que son como los académicos que enseñan con más responsabilidad docente e investigación, que contribuye a la enseñanza particular disciplinaria. Está el profesor, que es como el académico que con responsabilidades de docencia e investigación eh, para una disciplina determinada. Usualmente suele ser una figura destacada en su disciplina. Está el tutor universitario, que es un tutor responsable de impartir la formación universitaria y el programa. Está está el entrenador clínico, que es un consultor asignado con un aprendiz que brinda capacitación durante sus rotaciones y así. Está el supervisor educativo, que es un consultante que supervisa el periodo de formación de un alumno. Entonces, medical qualification, como que nos hablan de las cualificaciones médicas, que puede ser licenciado en medicina, en un título que a menudo se obtiene después de años de estudios, medicina, y así sucesivamente. Y nos habla también de los Doctor of Medicine, los doctores en medicina, y nos pone sus siglas al lado. Entonces, complete the phrase with verb from each box. Two phrases can be completed in two different ways. Okay. Demonstrated a competence or how to do something. Supervised training by ensuring she successfully completed her training. Deliver provide course of training program as a teacher. Take a course of training the program as a student. Assessment or demonstrate progress in competence. En la pareja va uno va con la D, dos va con la H, tres va con la F, 4 con la B, 5 con la G, 6 con la C, 7 con la A y 8 con la I, con la E. Entonces, write in full the qualification as a doctor and surgeon. Look at. Entonces, el doctor tiene un Bachelor of Medicine, Bachelor of Surgery, Fellow of the Royal College of Surgery in England, Fellow of the Royal College of Surgery of Ireland. Segundo, tiene un Bachelor of Medical Science, Doctor of Medicine, Member of the Royal College of Physicians. Tercero, tiene un Bachelor of Medicine, Bachelor of Surgery, Fellow of the Royal College of Physicians. Cuarto, tiene el último Bachelor of Medicine, Doctor of Medicine, Fellow of the Royal College of Physicians. Entonces, the overseas doctor. Okay, type of registration. To manage a street patient in the UK, all doctor must register with the General Medical Council, GMS. There are several types of registration. Professional registration is for doctors who have just qualified from medical school in the UK or from certain European Economic Area member state. Full registration is for doctors who have completed their year's clinical training. Immediate registration is for international medical graduates who have not completed the equivalent of a year's clinical training in the UK. Specialist registration is for doctors who have completed specialist medical training and have a certificate of competition training or CCT. So the GP register is a register for all those eligible, no, eligible is, I think, yes, eligible to work in general practice in the NHS. PLB, before they can obtain full registration, some categories of overseas doctors are required to take the Professional Linguistic Assessment Board, PLAB tests. PLAB is designated ensure those pass and can practice software of the level of SH or first appointment in the UK hospital. Part 1 consists in writing tests and knowledge, skill, and aptitude. Part 2, objective structure clinical examination. It consists 16 5-minute clinical scenarios, how the stations to assist professional skills. PLAB station and advice. Clinical examination, your ability to carry out a physical examination for a simulated patient and actor training to play this role will be assessed. Comfortable or intimate examination will be carried out using a mannequin and anatomical model. Practice skill, you will be assessed on practice skills such as suturing and giving intravenous injection. Communication skill, your ability to interact with a simulated patient is, or in some case, the examiner will be assess, assisted. Skills tests may include breaking value and giving advice in lifestyle. History taking, for ability to take an accurate history and make a resonant diagnosis will be assessed. Advice on the station from a successfully candidate. Read the instruction outside each station carefully. You have 1 minute for this. Don't forget the ABC airways briefing circulation protocol of every main station. Keep in mind safety precaution like throwing the sharps in the sharp bin. Check a patient, understand what is happening, then ask them about any concern they may have. Don't just give lecture, listen carefully in what the actor says. Ok, es como que nos habla de del médico extranjero y los tipos de realizaciones que existen. Eh, ok, para gestionar y tratar a los pacientes en el Reino Unido, todos los médicos extranjeros deben registrarse en el Consejo Nacional de Médicos, en el General Medical Council. Entonces, hay varios tipos de registro. Está el registro provisional, que para un médico que acaba de graduarse de la Escuela de Medicina en Reino Unido, de ciertos estados miembros del Espacio Económico Europeo. Está el Full Registration, como la inscripción completa para médicos que hayan completado su año de formación clínica. Está la inscripción limitada, que es como la inscripción limitada para los graduados médicos internacionales que no hayan completado el equivalente a un año de formación clínica en Reino Unido. El registro especializado, que es como para los doctores que han completado la formación médica especializada y tienen el certificado ya del CCT. Entonces, PBL, entonces antes de poder obtener el registro completo, algunas categorías de médicos extranjeros deben realizar el examen de Junta de Evaluaciones Profesionales y Lingüística. Y cómo está diseñado para garantizar que ellos aprueben y puedan practicar de forma segura el nivel de la medicina en la primera cita con los pacientes. Está la práctica competitiva, como la competencia práctica. Es como que la parte que consiste en una prueba escrita en conocimientos, en habilidades clínicas, en aptitudes. Y la parte del examen consiste en una estructura con el objetivo, consta de 16 escenarios de casos clínicos de 5 minutos, conocidos como estaciones para evaluar habilidades profesionales. Entonces, las estaciones de PBL, entonces el examen clínico, dice que eh, el asesoramiento evalúa estas habilidades. El examen clínico se valora su capacidad para realizar un examen físico de un paciente simulado. El actor está capacitado para desempeñar este papel. Incómodo o íntimo, los exámenes se realizan utilizando un maniquí o un modelo anatómico. Están los practical skills, que es como las habilidades prácticas, donde se valoran las habilidades prácticas como suturar y dar inyecciones intravenosas. Están las communication skills, como las habilidades de comunicación, donde se valora tu capacidad de interactuar con el paciente simulado, en algunos casos con el examinador. Las habilidades evaluadas pueden incluir dar malas noticias y dar consejos sobre estilo de vida. Y history taking es como tomar antecedentes. Se evalúa su capacidad para tomar historial preciso y tener un diagnóstico razonado. Entonces, advice on the station from a successful candidate. O sea, son unos consejos sobre las estaciones de un candidato seleccionado. Lea atentamente las instrucciones fuera de cada estación. Tiene 1 minuto para esto. No olvides el protocolo de ABC, Air Race Briefing Circulation, como el protocolo en cada estación de emergencia. Entonces, ten en cuenta tener los objetivos punzantes en todos sus contenedores para que no se contamine y chequear que el paciente comprenda lo que está sucediendo y que le puedas explicar Si cualquier cosa te pregunte, tú puedas responder cualquier inquietud que pueda tener. No se limita a dar una conferencia. Escucha atentamente lo que va a hacer el actor, lo que te va a preguntar, que va a ser un paciente actual. Entonces, with kind of registration, Irish doctor often a newly qualified Spanish doctor is professional registration. A newly qualified Nigerian doctor is limited registration. A doctor who has successfully completed the first foundation years or FY1 is full registration. An HHO who has successfully completed the foundation program is gained a certificate of completion of training after several specialist registered posts is specialist registration. Write the abbreviation in Word, look at A, B, and C opposite to help you. Any doctor who wants to work in the UK must register with the GMC's General Medical Council. Some overseas doctor must pass the PLAB test before they can register. The Professional and Linguistic Assessment Board. A part two of the test consists of the OSCE, auditive, structured clinical examination. In any emergency, remember the ABC protocol, airways, breathing, circulation. Before you can obtain a specialty registration, you must have a CCT, certificate completion of training. So complete the test. Okay, my name is Musa and I'm come from Yemen. I come to the UK about 2 years ago after graduating because Yemen is outside the EEA. I could only obtain limited examination with the GMC at first. It was very difficult for me to obtain a place of foundation program. Although I speak good English, I had to take the PBL test to show that I could work safely in the UK. If I had to give some advice to other candidates, it would be a counseling station. You shouldn't simply memorize set of phrase. It's better to really think about what you're saying to the actor and get information right. After completing my year's clinical training, I was able to obtain full registration, but I found it difficult to get in SHO post in my chosen specialty, pediatric. I hope you now have demonstrated their instant suitable candidate from the EEA. I completed my second foundation year. I should open in CCT, which will allow me to proceed to specialty registration with the GMC, an important step in the road in becoming a pediatric consultant. Gracias. Thank you for listening. It's all.